Hi, this is Roshan. Welcome to Cornea. So today our discussion is confined to the lipid metabolism on the biological actions of prostaglandins. Okay, so today's topic is a bit very important topic, and the competency which we are going to discuss is describe the therapeutic uses of prostaglandins and inhibitors of eicosanoid synthesis. Yes, synthesis and இது கேட்க மாட்டாங்க, biosynthesis கேட்க மாட்டாங்கன்றது காம்படென்சிலே நமக்கு தெரிஞ்சு போச்சு. காம்படென்சில என்ன சொல்லியிருக்காங்க, therapeutic uses of prostaglandins inhibitors தான் they'll ask you in the university examination. According to the competency you have to study the thing. Okay, so I'm KP Roshan Aditya. I'm studying MBBS. Okay, I belong to the department of biochemistry in this YouTube platform. There is Cornea YouTube platform. Okay, so learning objectives. So what are eicosanoids? Discuss the biosynthesis and regulation of prostaglandins. So this I will not discuss much because this is not needed for your university examinations. Okay, so since we are following the Tamil channel, it is confined to the MGR University. Biological actions and clinical applications of prostaglandins will be discussed in depth and in detail. Mechanism of action of aspirin will be a discussion topic. Okay, so let's start with the discussion on eicosanoids, and I'll be discussing one question which has been taken in your MGR University. Okay, ஆரம்பிக்கலாமா? What are eicosanoids? Okay, eicosanoids are nothing but these are 20 carbon compounds. We have derived lipids, we have compound lipids. In the derived lipids la ellame வந்து என்ன வரப்போகுதுன்னா prostaglandins தான். Okay, so that is these eicosanoids தான் இந்த derived lipids ல வரும். Under that eicosanoids we have prostaglandins, prostacyclin, all those things நம்ம என்னன்னு பார்க்கலாம். So eicosanoids are nothing but these are 20 carbon compounds. Okay, eicosanoids are nothing but 20 carbon compounds derived from arachidonic acid metabolites. Okay, is it clear? So these are derived from arachidonic acid metabolites. Now you will be able to say arachidonic acids are 20 carbon compounds or 21 carbon compounds. 20 carbon compounds only, right? Yes. So now let us classify these eicosanoids. If you just see eicosanoids, so we can classify it as two forms. One is prostanoids, another one is leukotrienes. Okay, prostanoids அப்படின்றதுல என்னலாம் வரும்னா prostaglandins, prostacyclin and thromboxane னு சொல்லுவாங்க. prostacyclinனும் thromboxaneுமே கூட நீங்க prostaglandinsல சொல்லலாம். But since we are following the Vasudevan, based on that classification we are moving on. Let's start. So I'm just writing eicosanoids. Okay, so eicosanoids are classified into prostanoids and leukotrienes. Okay, prostanoids and leukotrienes. These prostanoids நம்ம என்னன்னு சொல்லலாம்? If you just see, I can these prostanoids are subdivided into prostaglandins. Yes, எழுதுங்க prostaglandins, that is PGs. Okay, prostacyclin is nothing but PGI2. Okay, PGI2 is the prostacyclin, and thromboxane. Okay, thromboxane is nothing but TXA2. Is it clear? So this is the classification of the prostaglandins which you should be able to remember. Is it clear? Okay, because they can ask these kind of questions. What are eicosanoids? Name any two of them, mention their functions. Like that they can ask the question. So you should be ready. Okay, I'll show the NGR University question so that you will get the correlation. Okay, yes. Now coming to the depth discussion on prostaglandins. Basically, what are prostaglandins? See, prostaglandins are nothing but these are local hormones. Okay, so these are released by the tissues and they have some functions on CVS, RS, CNS, like that. Okay, so they are nothing but the local hormones. We will be discussing the biological effects of prostaglandins in a few minutes. Okay, before that let me talk about some stuffs. The biosynthesis and regulation usually கேட்க மாட்டாங்க. கேட்குற மாதிரி இருந்துச்சுன்னா I would have written in my pen itself, but கேட்க மாட்டாங்கன்றனால I have just given, just we'll revise it, summarize it. Okay, what is the most important is, if you want to skip this you can skip this. Because what is most important is you can go to the next you can skip 2 or 3 minutes and you can directly go to biological effects. Okay, biosynthesis and regulation. Okay, if you just see, membrane bound phospholipids are there. So these membrane bound phospholipids, why they are if you just see these prostaglandins இருக்குல, இதெல்லாமே வந்து இந்த prostaglandins வந்து they are not stored usually, but their precursors, avangaloda precursors வந்து they are stored in these membrane bound phospholipids. Okay, so once if I want to break down these phospholipids, I need the action of phospholipase. Okay, I need the action of phospholipase A2. Okay, so phospholipase A2 is responsible for breaking down the phospholipids. So once if the once if the phospholipase acts on the phospholipids, then the arachidonic acid metabolites will be released. In the arachidonic acid metabolites வந்து என்ன ஆகும்னா, it will act upon an enzyme called cyclooxygenase, or we call this enzyme particularly as COX enzyme. How will we call this enzyme as COX enzyme? Okay, so we have two types of COX. So COX1, COX2. Okay, COX1 is nothing but the constitutive form. Okay, constitutive form na, it is present in all the tissues of the body. Okay, but COX2 is specifically present only in the platelets. Okay, so COX2 is nothing but it's an inducible form. Okay, and it is present in the platelets. நமக்கு இப்போ ஸ்கின்ல ஐ மீன் இன்ஃப்ளமேஷன் ஃபார் இந்த இன்ஃப்ளமேஷனுக்கு ரெஸ்பான்சிபிளாக இருக்கக்கூடிய காக்ஸ் யாரு அப்படின்னு பார்த்தா COX2. ஓகே, ஸோ விச் காக்ஸ் இஸ் ரெஸ்பான்சிபிள் ஃபார் inflammatory response? One question you add on, I'll just give you. Okay, which COX responsible for inflammation? Nothing but your COX2. Okay, COX2, very important. What are the primary prostaglandins? Primary prostaglandins are nothing but PGH2 and PGD2. Once if it acts on the arachidonic acid, it will be converted into PGG2. Then this PGG2 will be converted into PGH2. Okay, sorry, PGD2 varadhu, PGG2 and PGH2. Okay, these are nothing but the primary prostaglandins. These are the MCQs which they can take. Okay, how many PGs are widely distributed in our body? 1, 2, 3, 4, 5 PGs. Okay, so 5 PGs are widely distributed on our body. This is not much of clinical importance. You should remember only this. Okay, இப்போ நமக்கு பாடியில் இன்ஃப்ளமேஷன் ப்ரோஸ்டாக்லாண்டன்ஸ் கிரியேட் பண்ணும் அப்படின்றது யார் பண்ணுறா? COX2 பண்ணுறா. இப்போ நான் வந்து இந்த COX2 இன்ஹிபிட் பண்ணணும்னா வாட் ட்ரக்ஸ் ஐ வில் கிவ் ஆன்டி இன்ஃப்ளமேட்டரி ட்ரக்ஸ், ரைட்? ஸோ இந்த ஸ்டெப்லேயே நான் வந்து இதை பிளாக் பண்ணால் மட்டும்தான் வந்து எனக்கு வந்து பாடியில் ப்ரோஸ்டாக்லாண்டன்ஸ் வந்து என்ன ஆகாது, ப்ரொடியூஸ் ஆகாது. அதனால வந்து I will control the inflammation. Correct, Dana? So this will be having that discussion at the end. Just you remember this. Okay, so all these prostaglandins will act on an enzyme called adenylyl cyclase, which will convert ATP to CAMP. This CAMP is responsible for creating the biological effects. Okay, so just remember this. We'll start with the next stuff. Okay, is it clear? So what is the most important sort is, now we will be discussing the biological actions on clinical applications of prostaglandins. So this is the very important stuff in your examination. Okay, and this they will compulsorily ask in 6-mark question. Compulsorily you will get this question in your exam, damn sure. Okay, so can we start? Okay, so now we are starting with the biological actions of prostaglandins. Let me start with the mnemonic. Okay, so PG. So prostaglandin, we will usually write it as PG. So first, before having the going to the discussion on we discussed prostanoids, prostaglandins, prostacyclin and thromboxane. So mostly these prostacyclin and thromboxane, PGI2 and TXA2, they are only responsible for, they are nothing but they are also prostaglandins only. Okay, so they are only going to act, they have the major role in CVS. Other systems la irukkiradhu vandu major role CVS la play panna poradhu yaar appdin paatha PGI2 and TXA2. So let's start. Okay, one mnemonic I will give and we will start. PGI2 and TXA2. Now you see here I will just highlight the word I. Okay, and I'm going to give you one mnemonic. What is I? I means inhibition. A means aggregation. Remember these words. If you remember these two words, the CVS, that is on blood vessels, the effect is completed. Okay, is it clear? CVS is nothing but the heart mein blood vessels hai na? Yes, so let's start. Okay, okay, now I'll make a tabular column and I'll write PGI2 TXA2. Okay, first PGI2 first this is a endothelium wall. Okay, now I'll just draw it in a red one. Okay, this is the wall of the endothelium. Okay, this is the wall of the endothelium. Okay, now if you just see, let me ask you one question. Ipo, if there is a injury here, so who will come? The platelets will come and it will aggregate here. Am I correct? The platelets will come and aggregate, correct or not? Yes. So if you just see, for aggregation of platelets, okay, the thromboxane A2 is responsible. So who is secreting this TXA2? The TXA2 is itself secreted by the platelets. Okay, just remember, it is secreted by platelets. Okay, it is secreted by platelets. அப்போ PGI2 என்னது? இப்போ இங்கே வந்து பிளேட்லெட்ஸ்லாம் வந்து குமிஞ்சு கிடக்கு. இப்போ இந்த பிளேட்லெட்ஸ் ரிமூவ் பண்ணணும்னா பிளேட்லெட்ஸே வந்து செக்ரீட் பண்ணாது. இப்போ இது என்ன பண்ணணும்னா, இந்த எண்டோதீலியம் வந்து இட் வில் செக்ரீட் த PGI2. அண்ட் இந்த எண்டோதீலியம் வந்து PGI2 இப்போ செக்ரீட் பண்ணுச்சு அப்படின்னா what will happen? It will remove all the platelets, okay, so that the platelets will disperse. So who is secreting this PGI2? It is secreted by the endothelium. Is it clear? This can be asked. So this is the very important stuff, so I'm discussing here. Next stuff let us discuss. Seri, mnemonic நம்ம படிச்சிட்டோம். What is the role of PGI? Means inhibition. So what is going to happen means platelets அங்க வந்து aggregate ஆக விடாம தடுக்க போகுது. That is the PGI2 ஓட role. So PGI2 is responsible for inhibition of platelet aggregation. Okay, so inhibition of platelet aggregation. அப்பனா இங்க it will help in the promotion of platelet aggregation. Is it clear? If platelet இங்க அப்பனா platelet வந்து இங்க inhibit ஆக விடாம தடுக்குது. Okay, so there is no platelet. அப்படிதானே? இப்போ platelet aggregate ஆயிருக்கு, PGI2 வந்து endothelium secrete பண்ண உடனே platelet வந்து இப்போ அந்த vessel wallல இல்லாம பண்ணிடுது. So can I say there is a vasoconstriction, vasodilatation? Can I call there is a vasodilatation? Yes, so there is a vasodilatation. Okay, அப்ப இங்க என்ன சொல்லுவீங்க? Plateletலாம் aggregate ஆயிடுச்சுனா how will the blood flow? It will be narrowed, that is increased, right? So that is there is a vasoconstriction. Okay, and if you just see one more point I'll give, this both PGI2 and TXA2 இருக்குல, both are responsible for decreasing the blood pressure. Okay, so this is all about the effect on CVS. This is compulsorily question, very very important. Okay, and this is the main clinical application. We use it in the atherosclerosis also. Just after a few minutes we will be discussing on that. Okay, so effect of CVS is completed. Next let us go to the effect of ovary and uterus. Okay, so effect on ovary and uterus. Who now இங்கே யூஸ் பண்ண போகிற PGs யார் அப்படின்னு பார்த்தா PGE2 and PGF2. Okay, PGE2 and PGF2. Okay, you can see here. So I have underlined this. Okay, I have underlined this stuff. Okay, yes, what is this stuff? So here you can see that the uterus is contracting, so the baby is coming out. So here this PGE2 and PGF2 are responsible for uterine muscle contraction. Is it clear? Uterine muscle contraction. Is it clear? Okay, are you understanding? Next, so what procedure is done here? Baby, they are killing the baby. Can't you see that? Yes, so they are just contracting the uterus and they are taking out the baby. Okay, so they are giving the prostaglandin so that the uterus will contract and they can make the child birth. Okay, so this is often used in the medical termination of pregnancy. Okay, prostaglandins. So one such example I will give you, that is a misoprostol. Okay, if you want you can take down, but that is for your PG purposes. So prostaglandins are used in the medical termination of the pregnancy for inducing the labor and also to control postpartum hemorrhage. Okay, Is it clear? So this is very important. Okay, so I have discussed this, very important. Okay, next let us discuss the effect on respiratory system. Now I'll just show you one thing. What is this woman doing? What is this woman doing? So this woman is unable to breathe. Why is this woman unable to breathe? Yeah, so the woman is unable to breathe because of the bronchospasm, right? What is bronchospasm? So whenever the bronchus சுத்தி இருக்கக்கூடிய மசில்ஸ் எல்லாமே வந்து அந்த bronchus பிடிச்சு டைட் பண்றப்ப என்ன ஆகும்னா மூச்சு சரியா விட முடியாது. So the tightening of bronchus by the bronchial muscles, okay, so, by the bronchial muscles leads to the difficulty in respiration. So this is called as a bronchospasm. Okay, so that you can see a normal airway and a narrow opening. So this is the tightened bronchiole here, so that the so this is what is the constricted airway. Okay, so now ipo na enna pananum idha relax pananumla. So let us discuss about this in detail now. So respiratory tract la nama enna main use pandrom appadina, the prostaglandins which we use is PGF and PGE. Okay, so remember D D comes after, sorry, E comes after D only, right? E comes after D only, right? So can I say, you should remember like this, E comes after D. So this PGE is a potent broncho dilator. Okay, it's a potent broncho dilator. Apana PGF is a opposite. It's a bronchoconstrictor of smooth muscle. Okay, it's a bronchoconstrictor of smooth muscle. Okay, is it clear? So in order to relieve this pain, what will I give? Yes, so I will give the PGE. Yes or no? So I will give PGE. Now one more question I will ask. So the muscles are constricted now, so I will give PGE to relax these muscles. Okay, correct. How will I give? In what form I will give? Aerosols, that's all, simple. Okay, nowadays PGE are used as aerosols, okay, to relieve the bronchospasm. Okay, so this is that. So this is a aerosol. Okay, is it clear? Yes. So now let us move on to the effect on immunity and inflammation. Okay, so what is happening here? What is the thing which you are seeing here? You have studied it in physiology in CVS. So this will be dealt by Mr. whom? Akash and Mr. Vayush. Either of them they will be discussing. I don't know who will discuss because I'm new to this channel. Okay, this is the picture which is showing the triple response. Okay, this is the picture which is showing the triple response. Okay, yes. சரி, இப்போ நான் ஒன்று சொல்கிறேன். இந்த ஃபஸ்ட்டு அந்த பார்ட் biosynthesisல I have told that prostaglandins will produce inflammation. Who is responsible for that? COX-2 is responsible for that inflammatory response. Okay, so how will that prostaglandins produce inflammation? When prostaglandins they produce inflammation by increasing the capillary permeability. Okay, so these are the capillaries. Okay, so imagine these are the capillaries. Okay, so what will happen means whenever there is a so prostaglandins will create inflammation, so that what will happen to the site, there will be a capillary permeability. Okay, so this capillary permeability leads to edema, and so it leads to edema. So all the fluids will go outside, so that will lead to edema, and slowly there will be an arteriolar dilatation. So the first thing which you see here is nothing but the red reaction. Okay, the first thing you see here is a red reaction. I'll just use black color. Red reaction. Okay, yes. Next here, the edema which you see here, and this is nothing but, you can see edema here, so that is the there is a bulge, so that is nothing but your wheal, and flare is nothing but the spreading of readiness to other sides. Okay, so this is nothing but wheal flare. So this we collectively call it as triple response, and which prostaglandins are responsible for this inflammation is triple response is nothing but PG. The only ஒரே ஒரு இடத்துல மட்டும் தான் நம்ம D யூஸ் பண்றோம், that is PG D2 and PG E2. Okay, PG D2 and PG E2. இன்னொரு ஒரு மெமரைசிங் டிப் நான் சொல்கிறேன். அனல்ஜீசியானா என்ன? பெயின் ரிலீஃப். analgesia oda opposite என்ன analgesic. Okay, analgesia pain relief, algesia அப்படினா என்ன pain. So E for pain. So prostaglandins will create they will promote inflammation. Okay, so that is how. So so this PGE is responsible for producing the inflammation and D ஒரே ஒரு இடத்துல தான் பார்க்கறீங்க, இங்க மட்டும் தான் பார்க்கறீங்க. That's all. Is it clear? Yes. சரி, இப்போ இந்த மாதிரி inflammation create பண்ணுச்சுனா what will happen? Can I say that it will also suppresses B cell and T cell function? Yes or no ma? So they will also suppress the B cell and T cell functions. Okay, so remember that. Okay, so this is another point regarding this prostaglandin. And what is this woman doing ma? The woman is sleeping, correct or not? The woman is sleeping. So I can say that this PGE is also a good sleep promoting substance. Okay, so PGE is E2 is nothing but it's a good sleep promoting substance. Okay, is it clear? So this is PGE E2. Okay, so sleep promoting substance, it's a good sleep promoting substance. It will act on the CNS and it will produce the sleep. Okay, is it clear? Next, let us discuss the effect on GIT. Okay, coming to the effect on GIT. So here you will be able to see a picture. What is this? Gastric ulcer. So இப்போவே சொல்லிடலாம், prostaglandin என்ன gastric ulcer create பண்ணுமா இல்லை gastric ulcerக்கு நம்ம ட்ரீட்மெண்ட்டாக கொடுப்போமா? Yes, we are going to give prostaglandins for the treatment of gastric ulcer. Yeah, so let us discuss that briefly. Okay, yes. Now, okay, very simple. Okay, so prostaglandins, when I give this, they generally inhibit the gastric acid secretion. Okay, so if they inhibit the gastric acid means we can reduce the ulcer, right? So they are given in the treatment of acid peptic disease. Okay, acid peptic disease. Is it clear? Also, these prostaglandins will do what? They will promote intestinal motility. இப்போ intestinal motility-யும் நல்லா இருக்கு. இப்போ இந்த gastric acid if gastric acid வந்து இங்க inhibit பண்ணிருச்சு. Okay, so that what will happen to the bowel? So இங்க வந்து intestinal motility நல்லா இருக்கு. அப்பனா what will happen? So can I say there will be excess bowel movement? So can I say there will be diarrhea? So diarrhea as an unwanted side effect. Is it clear? So this is the effect on GIT, that is the prostaglandins effect on GIT. Okay, so this is important, a bit important. Okay, so we are discussing all these stuff, so don't remember don't forget this. Okay, last but not the least, so that is the metabolic effects. So you know that prostaglandins எப்படி biological effects produce பண்ணுது? By acting on a molecule that is called as a CAMP molecule. Okay, metabolic effects பார்த்தீங்கன்னா prostaglandins, if you just see, they will always like the big people. Who is the big people? Glucose or glycogen? Glycogen. Who is the big people? Fatty acids or lipids? Lipids. So they love the good people, so they love the big people. So remember like this. So prostaglandins will, I'm going to give 3 points. Okay, so they will increase glycogen synthesis. Can I call this process as glycogenesis? Glycogenesis. Next, it will increase the lipid synthesis. Can I say this process as lipogenesis? Okay, so also this prostaglandin will act on the bone and it will take out the calcium from the bone and it will release into the blood. Okay, so it will release into the blood. Okay, so that is what, so it will increase the calcium mobilization from the bone. Okay, is it clear? So these are the important stuffs of prostaglandins, metabolic effects of prostaglandins. Is it clear? Yes. So now we are moving on with the last part of this topic, that is the mechanism of action of aspirin. Okay, one of the very very important stuff they will ask. Okay, prostaglandin எப்படி உங்களுக்கு inflammation create பண்ணுது? Prostaglandin வந்து it acts on an enzyme that is called as COX-2 and it will create the inflammation. We have discussed this, you see. So it will act on COX-2 and it will create the inflammation. Okay, you can see here. So it will act on the COX-2 and it will create the inflammation. Okay, so now what will happen if I want to stop இப்போ வந்து உங்களுக்கு இன்ஃப்ளமேஷன் ஸ்டாப் ஆகணும் அப்படின்னா இந்த ப்ரோஸ்டாக்லாண்டின்ஸ் எதுவுமே வந்து ப்ரொடியூஸ் ஆகக்கூடாது. அப்படின்னா நான் என்ன பண்ணணும்? ஐ ஹாவ் டு பிளாக் திஸ் I have to block the cyclooxygenase step so that no prostaglandins will be produced in your body. Correct or not? So what I'm going to do means I'm going to inhibit this cyclooxygenase, that is COX-2, by a drug that is nothing but that drug is called as aspirin. So this aspirin belongs to NSAID group of drugs. What do you mean by NSAIDs? Non-steroidal anti-inflammatory drugs. Okay. Is it clear? Phospholipase and inhibit பண்ணா there may be multiple. இப்போ phospholipase வந்து lipid synthesis லயும் நமக்கு யூஸ் ஆகுது. Correct or not? So we can't lipid digestion. So அங்க வந்து we can't stop that lipid digestion. So it may lead to some difficulties, abnormality. So we should not inhibit the phospholipase. That is stupid idea. Okay? So we should only inhibit the cyclooxygenase step so that no prostaglandins will be produced. Okay? Yes or no? Yeah. One more MCQ they can take is how can you convert prostaglandins to inactive prostaglandins? By in your body automatically that is controlled by this 15 hydroxy dehydrogenase. So that if they might ask you it in MCQ. Okay, just remember, no need to do much. Okay, yeah. So we'll start with the mechanism of action of aspirin. So aspirin, it's a non-steroidal anti-inflammatory drug. So it's an antiplatelet drug. Okay. So what happens is your COX-2, okay, it is produced by the platelets. Okay, so your COX-2 is produced by the platelets. So what will happen once if COX-2 is produced by the platelets? What is going to happen? So two things will happen. One is there is some inflammation, and also there is some platelet aggregation, right? Because COX-2, the major role of COX-2 is it will act on, yes, so COX-2 will act on, how does it produce inflammation? We have discussed, that is PGD2 and PGE2, okay, and it will promote inflammation, and also it will act on TXA2 and promote platelet aggregation. So that it is very dangerous because it may lead to heart attacks. Okay, so when I give the drug aspirin, administration of aspirin, so if I give the drug aspirin, then what is going to happen is, so let me take, this is your vessel wall. Okay, so sometimes this is your platelets. Okay, so this platelets is producing COX-2, and now this COX-2 will act on the TXA2. Okay, so now there is some aggregation of platelets. So now this is dangerous such that it might lead to heart attacks. Okay, so this might lead to heart attacks. So now what is going to happen is, now when I give aspirin, it will inhibit the COX-2. If it inhibits the COX-2, there will be no production of TXA2, and simultaneously the PGI2 வந்து என்ன ஆகும்னா, அது வந்து PGI2 inhibit ஆகும்னா aspirin selectively inhibits the COX-2. It will not act on the PGI2, but in your Vasudevan there is one mistake, that it will also act on PGI2, but that is not a correct one. So now what is going to happen means, more and more PGI2 molecules will be produced, so that all these will fade away. That is, your endothelium will become to normal. Okay, so that's why aspirin is it is going to be a good antiplatelet drug. How does aspirin acts as an antiplatelet drug? If your question is like that, aspirin, what is it going to happen means, it acts on it will inhibit the COX-2 in platelets. So there is decreased production of TXA2, so which leads to decreased platelet aggregation. Okay, if you put this flowchart for your how does aspirin acts as an antiplatelet drug, this is sufficient. Okay, is it clear? So this is all about the today's topic. So one question, MGR University question, it's very easy. So a 51-year-old person with a recent episode of myocardial infarction was prescribed aspirin as an antiplatelet drug by inhibiting cyclooxygenase enzyme. Which COX da? COX-2. I'm sorry, Okay, it's a COX 2 or 3. COX 2. Okay. So what are eicosanoids? We have discussed. Eicosanoids are nothing but 20 carbon compounds derived from arachidonic acid metabolites. Okay. So they are derived from arachidonic acid metabolites. So already it is discussed. Name two of them. Prostanoids and leukotrienes. Prostanoids mein we have prostacyclin, prostaglandin and thromboxane. So mention their functions. We have discussed the function on CVS, RS, ovary and uterus, CNS, that PGE2 is a sleep promoting substance. Then we also discussed the metabolic effects, all such stuff we have discussed, so you don't have to worry. Okay. Next, how does aspirin act as an antiplatelet drug by inhibiting cyclooxygenase? So we have discussed this here itself. Okay. Other drugs also you have, but aspirin is the best drug. Okay. Best drug. Okay, so we have discussed here itself, so you don't have to worry for that. Okay, so other prostaglandins, if you just see, you have prostaglandins from A to I. So this is not much important. I have put down from the Vasudevan the same line, so that you can feel that this person is discussing the book also. So I am happy. Yes, see, up to this you can read. This is not correct in your Vasudevan. We will correct it. I will just send a mail and I will just put up. Okay, because this is not correct. Actually, the aspirin will selectively inhibit the COX2 enzyme in platelets. Okay, it will not inhibit the, it will not partially, this statement is wrong. Okay, this is wrong. So I will just correct it in the Vasudevan soon. Okay, so just remember that aspirin irreversibly acetylates and inhibits the cyclooxygenase. Platelets cannot regenerate cyclooxygenase, and so thromboxane A2 is not formed in platelets. So hence there is decreased platelet aggregation. So therefore aspirin is useful in the prevention of heart attacks. So all the topics from today's objectives we have learned. Always, now after taking the notes, good night, study your notes. Okay, properly. Is it clear? I want you to study your notes properly. Okay, so this is all about today's class. So in the next class I'll come with an interesting video module. Okay, yes, in the next class we will be learning about the lipid storage disorders or sphingolipidosis. Okay, thank you. See you in the next class. Study your notes. Okay, until or otherwise you learn the mnemonics and you study the notes, you will not be able to score the marks. Okay, it's a very important 6-mark question, so kindly study the notes today and now itself. Okay, thank you.